Horses just got here. They're unloading now. I'm gonna put a mask on and see what I can do to help.
This baby right here.
That way?
Might be safest, honey. Let's both go
Yeah.
out. If you can both. Can I have several plates of hay, please? Several plates of hay. Quickly, if possible.
Jason, we might need you in here.
She's gonna fall soon. What do you want the hay for? Yeah, this horse.
Jason,
I just
we
didn't
need
want
you
her
in
to fall
here.
out of the tree.
Jason's gonna come.
Yeah, I think we need more
Yeah.
hands. And I have 2 more people. Come help, please.
Hold on, where's Jason?
2, 3.
Jason? Jason!
Okay, can we get this trailer, please? Lift it again one more time.
Jason, I got this. Can you help with the horse?
Hang on and let me move her legs.
Come on, baby.
Colt, please stop. Okay.
I need to close this to you.
Go
You
ahead.
can grab that. Come on.
Good girl. Cindy, if you want to keep the sun off her eye, I think that right on this eye. You got her?
Lydia, will you write your exam down on this one?
Yeah.
It's right inside the door.
Yes, I will. I'm just trying to see if anybody else needs payment.
Roll her over so we can get a picture from the other side.
Yeah.
Garrett, can you come help us? Poor vulva is just like. Oh my goodness. Okay, so we have reports that this alpaca was vision improved.
Precious thing.
Sure. Yeah, he can't see on either side.
Come on.
That's
Nicole.
fine. You got to hear this.
Okay.
How are these guys looking?
They're both blind. Yeah.
Very unique, very severe heart murmur that I have never heard before. It sounds like something is clunking around in the dryer.
So unloading them off the trailer was pretty rough. These are 2 pretty critical groups. I believe the second trailer was really bad. That poor old mare, she just immediately, we had to give her the last act of kindness, and that is the best thing for her. She had lots of cookies and peppermints in her last moments. But anyways, all these other horses need attention and help, so we're gonna carry on and do our jobs and get everybody else some help and cookies.
So our Minnie is next. Oh my goodness, you're cute.
Supposedly might be pregnant.
Hi.
And she's blind.
Hi, Mama. Oh, you're a good girl.
Get a water out to this ground here.
Hi. This eye is okay. This one probably at least needs the lids resected and closed. Hi, I know, it's very rude.
Loves cookies.
I don't have the cookies, but I'll give you some in a minute.
I can take that.
Okay, I know, it's so rude.
So what's going on here, Tony?
Very cute little miniature horse. She is blind. Said she might be pregnant.
Okay, no digital pulses there. Surgical intervention on the left eye before adoption, but not urgently.
Okay.
And I would like dental rods,
Come on.
foot rods.
Okay. Come on,
But
step
she
up.
seems very stable. Oh my goodness, you never know what you're gonna get at Horse Plus.
That's what the plus is for.
That's right. I
So
know.
how many alpacas?
I have not looked at an alpaca other than to pregnancy check one since vet school, which was like 13 years ago. So thankfully, Nicole gave me a heads up and I reviewed alpaca norms. And I understand we have a lady who takes care of blind alpacas, right?
Yes. I'm going to put them against the panel here, I think would probably be a good thing.
Okay. You okay, Tony?
Mm-hmm.
This is great. This is working.
I might have handled them before.
Yeah. Okay, baby. I know. You gotta let them know. to go get some 4x4 gauze.
Yeah.
So this is an adult.
You're intact.
Okay. Physical exam wise, if we have an experienced alpaca person who wants him, I can clear him to go.
Yeah.
He's very cute. If we've got neurologic disease, that kind of changes health status. I don't think he's got neurologic disease. I think he's got.
For now, let's put both of them in the round pen together.
I think that's. Is that okay with you, Tanya?
We're keeping, that's.
Is it? Yeah. Okay, so it's empty.
We'll put those two to keep them.
As long as we should be able to catch him, we'll just leave the rope on him.
Okay.
Come on. Let's go this way.
Tired.
Come on. Can we get up? Come on.
Look, that is totally a learned evasion behavior right there. It's like, I don't want to do it. I'm going to lie down. My parents' dog does that too. So we just took a look at an alpaca and a miniature horse. The mini is about 15 years old. Both of those animals are completely blind in both eyes. The mini, her heart and lungs sounded great. She's got some patchy hair loss and some hoof overgrowth, but her mouth palpated normally. Her left eye has some indication that she's developing entropion, which is that condition where the lids kind of roll in and rub on the eye. But the right eye looks to be very stable, and I think she's been blind for a long time. So when we have eye surgeries, sometimes they're like, this is an emergency, that eye is about to rupture, we need to do it right now, it's painful. And sometimes we have, before we adopt this animal out, we probably should do this because it's gonna be an expensive procedure that we can do here. So I put her down for a pregnancy check, hoof and dental radiographs, and a surgical procedure of the eye. She and the alpaca seem to be getting along really well. So we're keeping them together. The alpaca is an intact male. Full disclosure, I'm not a small ruminant vet. I've looked at very few alpacas since veterinary school, which was quite a while ago. This guy is very, very thin and a little pale and can't see in either eye. He has nystagmus, which means his eyes are kind of moving like this, and his head actually moves like that as well. So that's gonna help me narrow down some of the differentials for why he might be blind. But again, not an alpaca vet, so I'm gonna have to do some research there. We have a experienced alpaca rescue in the area who our staff reached out to before we got this guy. They're interested in taking him on, which would be great. We're gonna run a fecal egg flotation on him to check for parasites. I did not vaccinate him or do anything else with him today. He busted his lip, I think, in the trailer, but it's a very little superficial. He just hit it against his tooth. And I was able to determine that he is an adult, but I have no idea how to accurately age alpaca based on their teeth, so I just put down that he was an adult on his paperwork, and I think some veterinarian that's more experienced than I am with alpaca can probably do a better job at checking his age. But health-wise, both of them are not healthy but stable enough that we've moved them into a little paddock by themselves so they can decompress, and we're gonna keep rolling with intaking horses.
Got the llama and the little horse in the hay barn. That was challenging. I think it's gonna be in the main episode, so you might have to watch that, but yeah, now we got another one. What do you want next?
I think we're gonna try to do the
Well, I mean,
stallion.
after this one.
Yeah,
Are you wanting this big?
one right here is very sweet
Okay.
and has a big wound
Okay.
Yeah, we're doing that one.
on the
Yeah,
face.
they're getting that one.
So after the stallion,
We'll get that
I
one.
would love that one.
Okay. You'd have to have them against the wall. Let's just take them inside.
Is that important? Do you need the light or can I close
You can
this?
close it. Come on. Shh, 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 shh. Come on.
Up, 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 up. You're okay, I'm right here. Good boy. Easy. Our intake days are kind of triage. So health-wise, I don't have any concerns about him, but he's a stallion and he knows it. So we are just gonna identify him and then put him out in, we have kind of a long holding pen out here where he can see other horses but won't be in direct contact with other horses because he's a stallion. So that is our best plan for him right now, and we have him set up so that we don't have to lead him out there. He started out being somewhat tractable and pretty quickly got worked up. But he's an older stallion, so we're not surprised by that behavior at all.
So there's a brand on here. So Sydney's shaving the brand off so we can see what brand it is.
Okay, buddy. Good job, sir.
I think it's a quarter,
You're so cute.
quarter horse mare.
Your carpus hurts. She looks like she has a frowny face. Yes, can you take this, please? Oh, good girl. I know it tastes bad, I'm sorry. Why I gave this mare this pain medication. I really like phenylbutazone for musculoskeletal discomfort. It takes a little bit longer to kick in than Banamine that's administered intravenously. This little mare's heart rate is normal, but if you watch the way she's standing, she's avoiding putting weight on this carpus, this joint right here, but the carpus is kind of cold. So that tells me this is a very old injury, but the way she's standing does indicate discomfort. So we like to use heart rate as an indicator. She also has this big wound on her face that looks like it's not super old. So I wanted her to have some pain control, but I didn't urgently need it to kick in as quickly as we do sometimes. So I picked what I thought would help her with her knee better today than the other choice. A really big, like this size section of her forehead. So the next step is going to be to take some radiographs. This sweet little mare is just about as calm as she could be, so I think we can make it work. We might have to do that one more time a little lower down, but we'll see what we got. And then kind of some abnormal spacing. Obviously, when we take this, we've got the upper teeth juxtaposed over the lower teeth, so we kind of have to combine that with looking at both sides. You can really see that abnormal space right there. So see how these teeth are right next to each other, and then this one has a big space. And then when we look on the lateral side, we can see this kind of classic hook wave mouth where instead of a nice straight line, we kind of have her teeth go up and down like this. Often these teeth with these big spaces are unstable. And then these ones up here, these tooth roots should go way down into the jaw like these ones do, and see how shallow those are. So these teeth are probably close to coming out. So if you'll put blue part towards me, yep, right behind it. Perfect, great job, Peyton. There's a lot going on here, but to oversimplify, the edge of this joint should be really nice and smooth like this. This is completely abnormal. This is a big, either a bone chip or an osteophyte, which is also called a joint mouse. That's an indicator of really chronic, severe, long-term inflammation. And then she's got all of this going on over here and over here. So this is a bone-on-bone situation. This is a bone-on-bone situation. So she's holding her joint kind of gingerly out in front of her and trying to avoid either flexing or extending that joint all the way. And it's because when she does, those pieces of bone are kind of grinding on each other. Look at this fuzzy ancient friend here. Yeah. I think this horse may be in his or her 30s, if I had to guess. That shocking? Oh, it hurts. Okay. Hi, Mama, you good girl. You good girl. Oh, there we go. Just real slow. Okay. This is a pressure sore from prolonged laying down. Oh. Oh my goodness, that smells really terrible. 1, 2, 3, 4, 5, 6, 7. So this super sweet old lady is over 30. I am not one to speak confidently about aging in horses, but 30 is one of those benchmarks where the whole upper incisor becomes smooth. So she could be over 30. She has cataracts in both eyes. She has yellowing of her mucosa, which indicates liver disease, which is something we can check for in-house. She's got this adorable little ear that looks like she fractured the cartilage of her ear a really long time ago. But tragically, she's got really sad pressure wounds on both of her elbows and both of her hips. So it looks like she's just been laying down a lot. She's got a low to mid-grade heart murmur that's consistent with mitral valve insufficiency. These are just really sad cases for me because this mare, she's ancient. She deserved to be at home and have people that she loved say goodbye to her. Horse Plus gets a lot of these guys, and it's always really heartbreaking. I'm the first one to say age is just a number, and we have adopted out very old horses. But when we took radiographs of this lady's teeth, she looks like she's got a lot of mobility, a lot of missing teeth, and she's super sweet. She does not want you to touch her mouth. Her mouth hurts. She hasn't been eating out here at all. Like, she had hay and she just kind of ignored it. She really wants treats, but when she takes them in her mouth, she kind of like gums them around on her tongue first, so her teeth probably hurt. But in her case, it's probably that she's been in a state of starvation because she just can't chew food and her hindgut can't digest food anymore. So she's one where she's not acutely in distress per se, but it would have been much more fair to this sweet old lady to let her, pass peacefully at home instead of getting dumped into a slaughter auction where somebody probably got $50 for this horse. It really breaks your heart. And I'm happy that she's here and that she's had pain medicine and cookies, and we're gonna give her comfort and dignity in the end. Oh, hi. She's gonna be a quarter horse. And she's gonna be a 1 out of 9. All right, we're gonna get some dental rads on you. We're gonna go with 22, 23. Good job. Okay, so we're missing 1, 2, 3, 4, 5, 6. We're missing at least 6 teeth, and we're completely just jagged. And this mare is incredibly thin. She's only 23. She's got diarrhea staining on her hind legs. She's got hyperperistalsis. All kinds of broken and missing teeth. Oh my goodness, Nicole. There's a lot of gas up here. I wouldn't be surprised if this wasn't like an abscess pocket. That mare has had a lot of babies. I'm gonna trick you, and it tastes bad, and I'm sorry, but okay. Thank you, she got it. Oh boy. We're super lame in the hind end as well. Oh, you're cute. I would say that you look black. Yeah, that's old and really disgusting. So there's just actually one puncture wound right here. All of this is just like dried discharge. Run some blood work, and if his blood work looks okay, it won't take long to flush that wound out, but I'd rather do that where I can like clip, scrub, prep, do all of that. So let's pull blood. So now I'm wondering if he had like a partial dislocation. All right, sweet old man. Gotta get your boogers. I know. So this cute little pony gelding is about 27. He's got a puncture wound on his left shoulder. He's got a really mild heart murmur, which in older horses, they can get some valvular insufficiency. That's not a big deal. I graded him only at a 2 out of 6 on his heart murmur. He does have some nasal discharge. He's got some dental pathology, but it's not severe dental pathology. He definitely needs a dental. He needs that wound debrided, explored. He might need a drain. I very lightly probed what was going on there. So I'm gonna front load him with some antibiotics today. I'm gonna run a CBC chemistry on him down in our hospital, which will have those results today. And then tomorrow, I'm here as well. We're gonna sedate him, just a standing sedation, not full anesthesia, and explore that wound further. We were able to take radiographs to determine that it doesn't look like that's coming from like a bone infection. So that's one of those things that if we have what's called a sequestrum, where we have a broken piece of bone that's creating infection, those have to be surgically, you have to curette the bone off the bone, and that's more complicated than I want to tackle in a joint. I don't think that's the case with him. I think he just stabbed himself on something. So he's been a really good boy, and I'm hopeful that he'll do well with that. So that is our plan with him for today. Hi, were you being a bully? Hi. Okay, let me see on this side. You're doing great. 25. She looks great for 25.
Hey.
Oh no.
Teeth left.
She has no teeth.
54.
This is a stallion. Oh, yep, okay. Oh my gosh. You're a good boy. I'm sorry your lungs sound so bad. I'm gonna call him an Arabian.
Okay.
I'm gonna call him 13. Are you also a stallion? No, okay. Are you a cribber? Or are you really that old? I'll take some dental rads and see. You're okay, I know. You feel like something is gonna happen. Yikes. Ooh. Compensatory enough for a couple days, but yeah, that catastrophic dental pathology that I can't do anything to help this horse with, unfortunately. Good boy. Okay. Good, sir. So his mouth is deceptive because he has those little hooks that make him look like he's 5 or 7, but he's got a little tiny bit of a malocclusion. Cardiac ultrasound?
Yeah. His heart's not working.
Nicole! He's got 2 testicles. He has used them, I am guessing. Tani! Oh, the heart murmur. Trachea is the most interesting. Both lungs have increased inspiratory sounds. Easy, you're okay. It's not gonna hurt. Oh, that movement was probably me. Corresponds with, you can see how big his face is. Oh boy, cancel.
Is this the live?
So this is a
Jacob
true,
just fell over for everybody that was wondering why the camera got crazy.
this is a true lateral.
There he is.
This is the one that I update for you guys on this poor little baby colt behind me. He's about a year old. Dr. Marina, our wonderful radiologist, came down, looked at him, looked at our radiographs, and she confirmed what we suspected, which was that the abnormality on his face and the left side of his face has an area about this big that's enlarged, and it's very firm. And it appears to be bony. So what should be normal bone has proliferated out. One thing that can cause that are tumors. Sometimes fungal infections can cause it. But in addition to that, he has problems with both the maxilla and the mandible. So it's not like he just has an abscess on the side of his face. His bones are abnormal. So he has a raging infection up here, but he also has a tooth root that's about that long, which is way longer than it should be, extending up into his sinuses on the upper side and the lower side. And he has really severe infection extending down the trachea and into his lungs. And so, unfortunately, Dr. Marina confirmed that if it's an abscess, you can lance it and flush it out. But these changes, she thinks, have been happening over months and months. So this guy's only a year old. Either maybe he had really abnormal conformation, or he had an injury, or he has a tumor, we're not sure. But all of those differentials are not good, prognosis-wise. And he's really struggling to breathe, you can hear behind us. So we've gotten him as comfortable as we can, but we're really limited with what we can do, and we're gonna provide him with the last act of kindness, which really is, it's heartbreaking. He's a baby, but I'm so glad he didn't go, all the way to slaughter and spend a week in a truck. I don't think he would have made it, just because he's having such difficulty with breathing. You're a good boy.
The big boy.
You just popped your own neck. No? Okay. Right side looks like 28, left side looks like 27. I'm gonna want dental rads on this one. I smell infection. How's his teeth look? Oh yeah, this is disgusting. Yep. Oh my goodness, this smells terrible. So that smell is coming from these feet. He's the height of Nicole's head. Hi, sir. Good boy. Okay, he is 16.2. She's got diarrhea pooled on top of her vulva. Auction tag is 441. 5 out of 6. She's got a 5 out of 6 murmur. I know. All right, I'm gonna sedate her a little. I just can't do an exam, so I'm sedating her. Oh boy. I'm gonna set up to take some radiographs.
All right, that alpaca was absolutely heart-wrenching to have a completely blind alpaca with a little blind miniature horse in a kill buyer's trailer. Like, the trailer itself was just horrendous. There's thick manure everywhere, trash thrown around, aluminum cans. Like, it's like they don't even care. And these poor little precious animals were in there for I don't know how long. And all I can say is I'm just so glad that they're here and they're safe now, because that was really heart-wrenching.
She does not want it.
Okay, she doesn't want to stand on a leg.
She doesn't want to eat treats. She is over humanity. When they defecate, their poop is supposed to come out, but she has a literal shelf where her poop lands on top of her external vulva, which leads not just to the reproductive tract, but to the bladder. So if you've ever had a urinary tract infection, I'm 100% certain that this mare has significant chronic urinary tract discomfort because of her anatomy, because she's such a low body condition score that her rectum has recessed into her body because she's so thin.
Today we did our monthly buyout rescue mission, and we rescued 22 horses, a little miniature horse, and surprisingly enough, an alpaca.
The first alpaca we've ever had in Tennessee. We've had them at other locations before, but the first in Tennessee.
Yeah, and I would have to say a lot of sadness came off the trailer today. Like babies that have structural changes in their head to where they will not be able to make it. Like the bone and tumors are just grown into their actual nasal cavities to where they can't breathe. And it's so heart-wrenching to get especially young horses that have no chance.
Yeah, it's really hard, but if we didn't rescue them, they would be in really horrific shape without getting medical help. And this girl is next in line, and then there are 5 more waiting to have their intake done, and then it's done. But Jacob needs to go start editing this for you.
Jacob isn't the fastest editor, and I told him you're not going home tonight until you get it done. So
he's got to get it done.
Oh boy, he's going to be in for a treat this evening.
I'll give you a little rundown. We have her. She's an Arabian. We have 2 youngsters here, another youngster, and then 2 more older horses. So that's kind of what we have left. And thank you for watching.
But it's already 4 o'clock and Jacob's got to run. So.
Yep, he's got to run. So.
Alrighty, if you like this video, go ahead and leave a comment. Say, oh yeah, great job, Jacob. It's his first time doing the Almost Live. Usually I'm doing it. I had a lot going on today. So a lot of very important things that are going to become very evident very soon.
Yes.